Welcome to the Supervisor orientation for the Private Practice Clinical Placement with UNSW. This resource is designed to assist you in preparing for hosting students and guide you through the specific requirements when it comes to a clinical placement. Firstly, thank you for hosting a student. We recognise this requires a significant commitment from both you and your team, and we're grateful for your involvement in training the next generation of optometrists, as are the university and the students themselves. Their experience while in placement affects students' perceptions of your store and the Specsavers brand overall, and influences their decisions regarding employment, so it is essential that each and every clinical placement is a great one. It is equally important that you, your team members, and the patients who attend your practice also have a positive experience. This video will guide you through the specific requirements to ensure a great experience is had by all. Each University of New South Wales final year optometry student will undertake a clinical placement for 6 weeks. They will work within your practice for 4 days per week and must attend a feedback session on campus each Friday. So rostering for this placement is Monday to Thursday. The student will contact you at least 1 week prior to the placement commencing. During this initial contact, the student can be advised of rostered days and start times, who to ask for on their first day, and any other high-level requirements. If the student does not get in contact with you, please reach out to your contact in the graduate team and they will follow up. Students have had the following experience at the UNSW Optometry Clinic and other external placements as part of their studies so far. They performed all clinical procedures associated with a comprehensive eye examination, performed other clinical procedures, guided practical experience in the therapeutic management of ocular disease, fitted a limited number of patients with contact lenses, and applied their dispensing skills, including recommendations of the most suitable options to meet patients' visual needs. Throughout this placement, students are expected to complete 50 direct patient examinations under supervision. It is understood that the experience will vary depending on the student's skills and abilities, the individual practice location, and the equipment available. Where possible, they shall participate in examinations in the following areas: history and symptoms, retinoscopy, refraction, binocular vision analysis, and further listed on screen. Students should also gain experience in practice management, handling patients, and dispensing. Placement supervisors will be required to give feedback to students and the university throughout the placement. An online portal will be used to complete assessments. You will be asked to complete a questionnaire based on the student's professionalism, communication skills, clinical skills, and patient management. You will also be asked to identify areas of weakness that can be improved on throughout the placement. The assessment should be completed each week throughout the 6-week placement. The assessment portal can be accessed via the UNSW School of Optometry and Vision Science website, and details of the process involved to access this portal will be emailed to you directly from the university. At the start of the placement experience, it will be beneficial to understand the level of experience and current competencies of your student, as well as their experience with Specsavers so far. For example, have they worked in a Specsavers store? Or have they completed a clinical placement with us previously? If so, progression through to parallel testing may be more rapid. As a guided structure, it would be beneficial to focus on the retail aspects and patient journey before shifting towards consulting rooms to observe and perform clinical tests.